Anxiety is a natural human emotion that everyone experiences from time to time, but for some, it can become chronic and debilitating, significantly impacting their daily lives. It is often defined as a feeling of worry, nervousness, or unease, typically triggered by uncertain situations or events, and it can range from mild unease to overwhelming fear. When anxiety becomes persistent and excessive, it can disrupt normal functioning, and prevent individuals from fully engaging in life. The symptoms of anxiety can be both physical and emotional. Physically, a person with anxiety might experience an increased heart rate, shortness of breath, sweating, dizziness, and muscle tension. These reactions are part of the body's fight or flight response, but when they occur frequently or inappropriately, they can lead to discomfort or distress. Emotionally, anxiety often involves constant worry, fear, or dread, particularly about future events or situations that may not even occur. It can cause irrational thoughts, such as imagining worst-case scenarios, and make it hard to concentrate or focus on tasks. People with anxiety may also experience behavioral changes, such as restlessness, irritability, and avoidance of situations that might trigger anxious feelings. Social withdrawal is another common behavior, as anxiety can make it difficult for someone to interact with others, further reinforcing their sense of isolation. Anxiety can stem from various factors, both biological and environmental. Genetic factors play a role, as anxiety disorders often run in families, suggesting that some individuals may be more predisposed to experiencing anxiety. Environmental stressors, such as job pressures, financial problems, relationship difficulties, or traumatic events, can also contribute to the development of anxiety. For example, someone who has experienced a traumatic event, like an accident or the loss of a loved one, may find themselves constantly anxious or on edge. In addition to these external factors, neurobiological factors also play a significant role in anxiety. Imbalances in brain chemicals, like serotonin and dopamine, have been shown to contribute to anxiety disorders. Furthermore, individuals who suffer from chronic health conditions, such as heart disease or diabetes, may find that their anxiety is heightened as a result of their physical health challenges. Psychological factors, like a tendency to overthink or catastrophize situations, can also amplify feelings of anxiety, leading individuals to anticipate negative outcomes or worst-case scenarios even when there's no concrete reason to. The after-effects of chronic anxiety can be serious, affecting both physical and mental health. Long-term anxiety can lead to persistent health problems, including high blood pressure, cardiovascular issues, and chronic fatigue. The constant physical tension in the body can also lead to muscle pain, headaches, and digestive problems. In addition, the mental toll of anxiety can lead to the development of other psychological disorders, such as depression or substance abuse. A person with anxiety may resort to unhealthy coping mechanisms, such as alcohol or drug use, in an attempt to self-medicate or escape their feelings. Cognitive abilities can also be affected, with memory and decision-making becoming impaired as a result of constant worry. Socially, anxiety can have a significant impact, as individuals may withdraw from friends, family, or colleagues to avoid the stress of social interactions. This withdrawal can further exacerbate feelings of loneliness and isolation. Furthermore, anxiety can hinder personal and professional progress, as those affected may avoid new opportunities or challenges for fear of failure or being judged. However, anxiety is treatable, and there are various approaches to managing and overcoming it. One of the most effective forms of treatment is therapy. Cognitive behavioral therapy, CBT, is widely regarded as the gold standard for treating anxiety disorders. CBT helps individuals identify and challenge the negative thought patterns that fuel anxiety, replacing them with healthier, more realistic ways of thinking. Another approach is exposure therapy, which involves gradually and safely exposing the individual to the situations or triggers that cause anxiety. Over time, this can help desensitize the person to their fears and reduce their anxiety response. Psychodynamic therapy, which explores past experiences and unconscious thoughts, can also be helpful in uncovering the root causes of anxiety. For some individuals, medication can be an effective treatment to help manage symptoms. Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed to help regulate the brain chemicals involved in anxiety. Benzodiazepines, which provide short-term relief, can also be prescribed, but they come with a risk of dependency, so they are typically used only for brief periods. In addition to therapy and medication, lifestyle changes can play an important role in managing anxiety. Regular physical activity, such as walking, jogging, or yoga, can significantly reduce anxiety by boosting the production of endorphins, which are the body's natural mood elevators. A balanced diet rich in essential nutrients can also help improve brain function and stabilize mood. Ensuring a consistent sleep routine is crucial, as lack of sleep can exacerbate anxiety symptoms. Practicing mindfulness and relaxation techniques, such as meditation and deep breathing exercises, can help calm the mind and body. Mindfulness involves focusing on the present moment without judgment, which can reduce the tendency to ruminate on anxious thoughts. Breathing exercises, such as deep belly breathing, can activate the parasympathetic nervous system, which helps the body relax and counteracts the fight or flight response. Yoga and Tai Chi, which combine slow, deliberate movement with breath control, are also powerful practices for reducing anxiety and promoting overall well-being. Social support is another key factor in managing anxiety. Engaging with friends, family, or a support network can help reduce feelings of isolation and provide comfort during difficult times. Support groups, either in person or online, can be beneficial, as they offer an opportunity to connect with others who are experiencing similar struggles. Talking about feelings of anxiety with trusted individuals can help normalize the experience and make it feel less overwhelming. Lastly, long-term management of anxiety involves consistent practice of coping strategies. Cognitive restructuring, for example, involves identifying irrational thoughts and replacing them with more balanced, realistic perspectives. Building resilience through mindfulness, relaxation, and coping skills can help individuals better manage anxiety and lead a fulfilling life. In conclusion, while anxiety is a common and natural emotion, it becomes a problem when it is chronic, and affects an individual's quality of life. Understanding the symptoms, causes, and effects of anxiety is the first step in addressing it. Through therapy, medication, lifestyle changes, and social support, anxiety can be managed effectively, allowing individuals to regain control of their lives. With the right approach, individuals with anxiety can learn to manage their symptoms, improve their mental and physical health, and live a more balanced, fulfilling life. For more, please subscribe and like on the channel.